So the SPIRIT head-to-head study is the first biologic head-to-head study that we've had in psoriatic arthritis. So I think that's a really important change because we've seen lots of studies comparing to placebo before. But obviously when we're choosing therapies, we're choosing between different drugs. So it's much more clinically relevant to have a head-to-head comparison. I think it was quite a pragmatic study, so the patients had the dose that they would have in normal clinical practice according to their psoriasis, and really looked at all of the different domains of disease, which is important. We saw obviously superiority for ixekizumab on the primary endpoint, but that's because it was a combination of skin and joints. And we knew from previous studies that IL-17 inhibitors and ixekizumab are superior to TNF inhibitors for the skin. And what this study also shows is that they're non-inferior for the joints, but not superior. It wasn't powered to look at superiority here. I think that the other thing that's important in the outcomes is that it showed superiority for a lot of our treatment targets. So the kind of composite targets like minimal disease activity, where we're looking for control across joint, skin, enthesitis and patient-reported outcomes, clearly showed superiority for ixekizumab, and that's what we should be aiming for. In day-to-day practice, we should be treating to target, we should be aiming to achieve MDA, and so it's a really key outcome to see in a study like this. So I think we need more detail from the post-hoc analysis in this study that could help us in terms of some of the outcomes. We know that we've got other head-to-head studies coming. So there's a head-to-head study with secukinumab, which is currently recruiting, and that's looking at superiority in arthritis, which hasn't been tested before over a TNF inhibitor. So that will be really interesting data. We're also seeing, and I think this is a really positive move, that a lot of the newer drugs that are coming to market, so some of the JAK inhibitors, for example, are actually doing studies head-to-head in their first phase 3 study, so versus placebo and powered to compare to usually adalimumab as the kind of market leader of drugs. And so that gives us immediate data, not with a second study, but immediate data in the phase 3 trial that tells us whether the drug works against placebo, but also how it compares to our current most common first-line biologic.